New at 6, Hawaii psychiatrists and psychologists are once again in conflict over who should be allowed to prescribe drugs for mental illness. As our Daryl Huff reports, a key committee agreed today to give psychologists limited prescription power.
The conflict between psychiatrists who can prescribe mental health drugs and psychologists who can't has been around for years, but Hawaii's rising rate of suicide, especially on the neighbor islands, is putting pressure on lawmakers to look for a compromise.
I lost 2 first cousins to suicide. Neither was seen by a mental health professional in time to save their lives. That's a reality for too many families. Care is hard to access, delays are deadly, and people fall through the cracks.
Kauai Mayor Derek Kawakami opposed prescriptions by psychologists as a state senator until he said he lost 10 friends and relatives.
And I'm not saying that this measure would have saved them, but all I'm saying is that for rural communities, Kauai being the smallest community in the state of Hawaii, something like this, I have to believe, would help.
The governor's lead advisor on health care supported the bill because it requires a prescribing psychologist to receive significant additional training and be supervised by a psychiatrist.
And that supervision creates what I think is a healthy thing, which is a team led by the psychiatrist to manage the psychologists who want to do this.
The committee got more than 150 pages of testimony on Senate Bill 847, much of it from psychiatrists who say the additional training is not enough to understand the challenge of potentially deadly mental health drugs.
When you go and get a crash course, would you trust your loved one to go get that crash course medication, or from one of us that has done this for years?
They argued the best way to improve access to care is through telehealth visits and incentives to recruit and train more psychiatrists.
But there are other proven solutions to address the mental health crisis in our state.
This particular bill is more than a crash course. It requires the collaboration.
Big Island Senator Joy San Buenaventura chairs the Senate Health Committee, which approved the bill today.
We keep seeing the same canned testimony regardless of how much we made restrictions on the bill.
The bill now goes to the Senate Consumer Protection Committee and then has to pass the full Senate to get to the House. In other words, a long way to go for a controversial issue. Daryl Huff, Hawaii News.